Hello, my name is Lucas Jacobson, and in this documentary, I will be discussing what euthanasia is, why it is considered sinful from a Catholic perspective, and the impact it has on society. Euthanasia is defined in the Catechism of the Catholic Church in paragraph 2277 as, quote, an act or omission which of itself or by intention causes death in order to eliminate suffering, constitutes a murder, ... end quote. If euthanasia, according to the Catechism, is classified as a murder, then one does not need to look far within the biblical text to see its prohibition. In the book of Exodus, chapter 20, verse 13, it specifically states, quote, "You shall not kill," end quote. Thus, in this passage, the Bible affirms the dignity of every human being and the respect that is due to them coming from this. In 1 Corinthians chapter 6, verses 19 to 20, it states, "Do you not know that your body is a temple of the Holy Spirit within you, which you have from God? You are not your own, you were bought with a price, so glorify God in your body," end quote. This clearly shows why euthanasia is considered unacceptable according to the Catholic Church. This is particularly manifested in the part of the quote where St. Paul states that, quote, "You are not your own, you were bought with a price." In this quote is contained a major reason for the sinful nature of euthanasia. In saying, quote, "You are not your own," unquote, St. Paul implies that human beings are not free to live their life in whatever way they desire. From this, it is implied that God has control of every aspect of one's life, including its earthly termination. Another passage in which euthanasia is condemned is in the book of Ecclesiastes, chapter 8, verse 8, quote, "No man has power to retain the spirit or authority over the day of death," unquote. In this passage, the author maintains that human beings do not have the right to make the decision to end their life or that of another person because this action directly belongs to God. Medical advancements open up new angles with which to look at the issue of euthanasia. These new angles created questions and prompted the Congregation of the Doctrine of the Faith to promulgate this declaration to answer these questions. This declaration underscores the undeniable dignity of each human individual. According to the document, an individual's existence is the foundation of who they are and what they do. Christian, quote, believers see in life something greater, namely a gift of God's love, which they are called upon to preserve and make fruitful, unquote. Furthermore, all human beings must direct their lives based upon God's will. Additionally, the document explains how at present, quote, the word euthanasia is used in a more particular sense to mean mercy killing, unquote. No one is permitted to administer or obtain euthanasia because it is a denial of God's authority, a refusal of His love, and the withholding of what one owes to their neighbor. The document clearly points out that the solution to the problem of euthanasia is loving the individual properly and adequately. For this to occur, one needs to experience the love of God and of their fellow human beings. However, they especially need to experience this love from those who are close to them. Why is euthanasia a sinful action according to Catholic theology?
Well, first we have to make a couple of distinctions. One of the problems we're dealing with today is a lot of semantic issues, people playing with words, and that this is another one of those. Thanatos is the Greek word for death, and eu is the word that means good, so it actually means a good death. And that's not necessarily what it is. This is about intentionally putting somebody to death. It is murder, pure and simple. It is a violation of the fifth commandment, and it is an act of directly and intentionally putting somebody to death. And so it is not a good death. It may not be a painful death, depending on how they do it, but it is definitely not a good death. And so because it is literally an act of murder in the eyes of the church, that's why it is sinful, and that it is only God who has the right to bring somebody home, to take somebody's life, and it is not up to human beings to make that decision.
My next question is, how do you explain some of the theology behind why euthanasia is wrong when people are going through the emotional stress of their loved one dying?
Well, there are a couple of things to consider. First of all, and most important, is the dignity of the person. Every person's made in the image and likeness of God and has dignity, and part of that dignity is the life that they have. And so it's difficult when people are going, as you said, through the emotional aspect of it, and sometimes they just want to see the suffering stop. And yet the other side of this that people have to consider is the fact that they would have to live with this for the rest of their lives if they made the choice to have somebody they love put to death. And so that's where, from the point of view of the caretaker, that they would need to consider that. So the dignity of the person who is dying, but also the fact that the person who is making the decision is going to have to live with that decision for the rest of their life.
Yeah, I know. That would just eat me up, so I can't imagine what it does to people.
Yeah, it seems like an easy or even a good solution in the short run, but because it would end somebody's suffering, but in fact it may cause more suffering. God uses the suffering that we endure sometimes to break through a hard shell that we've got built up around us so that we can repent, so that we can prepare ourselves for eternal life. Whereas if somebody is put to death before they get to that point, then their soul could be lost because they never got to that point of repenting. And so again, what would appear to be a quick solution to a tragic problem, that is, of somebody suffering terribly, can actually have eternal consequences, both for the soul of the person who was suffering, as well as for those who are the ones making the decision and carrying out the decision to euthanize somebody.
The next question is, how do you explain what true compassion is to someone who considers euthanasia an act of compassion?
Well, again, this is where the semantics come in. It's false compassion. Euthanasia is false compassion. The word compassion means to suffer with. And so to look at it and say, well, I'm going to put an end to somebody's suffering is exactly the opposite of compassion. Because compassion means I will suffer with this person. I will stay with this person through their suffering. I will support them through their suffering. And so it really is, it's false compassion and false charity in that way to suggest that somehow this is the better thing to do. And so what we have to do is look ultimately in as a matter of faith to the cross, and to be able to recognize that when God allows us to suffer, He's giving us a share in His own passion, and that in that sense it can be seen as a blessing, whereas on the natural level we tend to look at it as a very negative thing. But with faith and looking at Jesus, we can see it positively. And that's ultimately where true compassion can come in, because you're uniting, that person can unite their suffering with the suffering of Christ. Not only then is that meritorious for the individual, but it can also then be used by our Lord for the salvation of souls.
How does one affirm and explain the dignity of life to someone who is suffering from a debilitating illness?
Well, first of all, it goes back again to the point of recognizing that all of us are made in the image and likeness of God. It also goes back to the point I mentioned earlier of looking at the cross, looking at the passion of Jesus, and seeing what He endured, and that this is a participation in that, as St. Paul talks about in the first chapter of his letter to the Colossians. But also then to recognize for a person who is in that kind of a situation, as awful as that is for them to be in that situation, if they can see that as an opportunity or a means for other people to practice charity. So charity, remember, is a two-way street. We tend to think of it as just simply giving, but it's both giving and receiving. So part of when a person receives the charity of another, that's part of the gift that they give to that other person. So this individual who is in a debilitating state, if they can receive graciously the charity of others who will care for them, at that point, that is an act of charity for others. That is exercising their dignity as a human person. And it is also then of the greatest dignity to recognize that this is a participation in the suffering of Christ, which again, as I mentioned earlier, can bring about the salvation of souls, the conversion of sinners, as well as their own growth in holiness. One example to look at, in that would be, there was a little girl out in the East Coast. She's since died, but her name, they called her Little Audrey, and she had drowned in a pool, and they were able to resuscitate her, but she lived in what they call a vegetative state. But she was a victim soul, and she took on the sufferings of others. They would come, and even though she couldn't respond, she couldn't speak, she couldn't interact with the people, she was just laying in her bed. Under her skin, they could see the crown of thorns, they could see the stigmata. There were Eucharistic miracles that happened there, whole number of things. They've got a video on her if you want to look all that up. But anyway, this person who's in that debilitating state, if they're willing to accept this, can be a victim soul. They can offer their suffering for others, and that's what little Audrey was doing. She would take on the suffering of these other people, and they would be healed, and suddenly she would have whatever they had, and she would just accept that and pray for them, and so a person, the prayers of a person who is suffering are very, very powerful, and so we don't want to minimize that in any way, and so it we would look at it again on a natural level and say, oh, well, this is an undignified sort of way to live. But as Christian people, we would look at it just the opposite and say, no, if this is a participation in the work of redemption, in the work of salvation, there is nothing more dignified that a person can do. And so that's the piece to be able to recognize.
Using procon.org, there are many arguments for and against euthanasia, based on looking at the issue from various perspectives. In support of euthanasia, Dr. Gary Comstock, who experienced the death of his newborn son, who had trisomy 18, argues that infants with severe disabilities have no meaning to their lives and suffer dreadfully. Consequently, when speaking of parents, he states, quote, shouldn't we be allowed the swift, humane option afforded the owners of dogs, a lethal dose of painkiller, end quote? On the other hand, while Wesley J. Smith sympathizes with the painful situation of Dr. Comstock, he does not assent to his conclusions regarding the permissibility of infant euthanasia. He points out that, quote, at Nuremberg, the German infanticide program was deemed a crime against humanity. Let's not abandon that wisdom, unquote. Based on the teaching of the Catholic Church, the position of Dr. Comstock can never be accepted. According to church teaching, human beings have infinite dignity regardless of their lack of abilities or their state of functioning. Furthermore, the Church maintains that human beings are created to have a relationship with God and other human individuals, based on providing and accepting selfless love. If one does not maintain this principle, atrocities like Smith brought to mind will possibly occur in the future on a mass scale. The next question is, if a brain scan shows no activity in the brain, should a Catholic take this as a sign from God that they are supposed to take their loved one off life support, or should a Catholic make the decision in another way, given that technology can sometimes be inaccurate?
Well, it's a great question. The thing we have to look at is more than just the brain. In other words, to realize that if somebody is on life support, that is what would be considered extraordinary means, and so the Church makes a difference between what is ordinary and what is extraordinary. Ordinary means that is something every person must be given, would be four things. So that's nutrition, hydration, oxygen, and painkillers. The person themselves could turn down the painkillers if they want, but if the person's not conscious, then we have to make sure that their pain is controlled. So anything beyond that is considered extraordinary and does not have to be done. So if a person is on life support, for instance, because they just had open heart surgery, it would be wrong to remove that ventilator a day after surgery because the person will die. But the idea of that is that it would be temporary. So normally after surgery, it might be there for, say, 2 or 3 days. then they would be able to remove it. The person would be strong enough to breathe on their own and be okay. If there is no reasonable expectation of recuperation, then the life support could actually be removed without any moral implications. Now, if the question you're asking about has to do with brain activity, one would also look at the other vital organs. Are the other organs starting to shut down? Are the kidneys beginning to shut down? Is the liver and the things, other organs you can look at and say, if a person has begun what you might call actively dying, at that point, all of the things can be removed, and it is a matter at that point of allowing a person to die rather than putting them to death. So if you're taking somebody off of life support for the purpose of killing them, that would be wrong. If they're clearly starting to shut down, and you're simply going to allow the natural process to take its course, that would be acceptable.
How does a Catholic patient or family express that they want the medical professional to abide by their wishes and moral standards in a firm but loving way? Would they try to explain the theology behind their beliefs?
When you're dealing with the medical profession, you don't necessarily have to explain the theology. It's perfectly fine to do so. You just need to be very clear. So first of all, these days they like to have what they call living wills, or they called anyway the medical, who's going to have your medical power of attorney and things like that, and so there are a couple of things I always tell people: don't be too explicit in those things. Because again, you're dealing with doctors who are looking at things from a different perspective. You don't know what's going to happen, So if you fill out one of these forms today, and you say, well, if I'm in this kind of condition, this is what I would want or not want. The problem is you don't know why you would be in that condition. If you're in a car accident, that's very different from having a stroke or a heart attack or an aneurysm or so there are differing reasons why a person would get into a certain condition.
Oh, yeah.
So what I always tell them is just simply say, I do not want anything in opposition to the teaching of the Catholic Church, and then here is the person who will be making the decisions. And so you state the individuals who will be making the decisions, and you have a first and a second choice so that they can contact them. And the other thing now, when you're in the hospital, is make sure somebody is there with you, because you have to have somebody watching what's going on for differing reasons. I mean, again, some people are malicious. They'll do stupid things. Other things, they're very, very busy sometimes. The nurses might have several patients and they're just racing in and doing something. There needs to be somebody watching what's going on, questioning what's going on, because sometimes things happen that are accidental, that would be not good. Other times it's malicious and intentional. But anyway, in the healthcare directives, which is what those would be, living will or healthcare directive, it's a matter of just not, like I said, not being too detailed about things, because you don't know what's going to happen. Just be very clear. This is what I want. Only nothing in opposition to the teaching of the Church. And then here are the spokesmen who will make the decisions, so that way somebody is making a decision. If you're not what they would call decisional, if you're not conscious and able to make the decision yourself, who's going to make the decision for me? And you need to make sure that person knows what your wants are. You need to make sure that person has only your good in mind, and that they can contact somebody if there are questions. Because these days medical morality has become very difficult based on the technology. Technology can do some wonderful things. It can do some pretty awful things, and so it also becomes very confusing. And so if the person knows, okay, who do I call if I have a question, that would be helpful. But it's still that person who's making the decision. And as long as that's clear and that's the individual, then the doctors will have to do what that person will dictate. And again, need to be very clear. For instance, I know of a situation, the doctor told me this. There was somebody who had heart surgery. The cardiologist came in, and it was at a teaching hospital. There were some students that were there, and at the bottom of the bed it said DNR, do not resuscitate. And so one of the students walked over and pulled the plug out from the wall that had the ventilator on it. And the doctor said, what are you doing? The student said, do not resuscitate. And the doctor said, it said, do not resuscitate. It did not say, please kill. And so again, you need to have somebody. Thankfully, that doctor,
Oh wow.
had some morals, but the student did not. And so if there's a family member there, or your spokesman, whoever that would be, to be able to watch over what's going on, and again ask questions like that doctor did, and say, oh no, you don't do this. How much are you giving this person? Why are you doing this? What is this? And so that they can make sure that what is happening is truly for your good.
What do you think are the main reasons for pushing the legalization of euthanasia in our contemporary world?
Well, it depends on the perspective. If you're looking at it from the perspective of family and friends, it's oftentimes, again, the false sense of charity and compassion that we talked about earlier. They just want to see the suffering end. For some people, unfortunately, it's a very, very selfish thing. I've been taking care of this person for a long time. I'm exhausted. I have things I want to do. If this person were dead, I would be able to get on with my life, that kind of thing. From the medical profession and the legal profession, it's about money. It's basically a socialized medicine kind of thing, and they would look at it and say, this person is just lying here in a bed suffering, doing no good for anybody, and taking up a lot of money, a lot of resources. They're taking up a hospital bed. It's costing thousands of dollars a day to keep them alive. For what? They're only going to die within a week or two anyway. And what good are they? We could use that money. We could use this hospital bed for a 20-year-old who's going to live for another 60 years and be able to be healed, where this person isn't going to be healed. And so that's kind of their argument for it. But again, it's a false sense of compassion. Ultimately, it comes down to money. That's where their whole thing. You can always follow the money trail on these things.
Thank you for all your valuable insight.
Usually a person's put on hospice if it's thought at least that they have 6 months or less to live. But what happens is that there are many hospice programs who will intentionally give the person too much morphine. It's permissible morally to give a person, again, as I said earlier, to control their pain. You can give them a lot of morphine if that's what they need, and that may slow down their respiration, and it may even hasten the death of the person, but that's not why you're giving it. In these cases, they will give an abundance of morphine, way, way more than what the person needs, knowing that will slow their respiration down a long way, and they will die. And so again, it all comes down to the money. The people in the hospice programs will get a set amount of money, and if the person dies within a week, they get all that money. If the person dies in 6 months, well, they used all that money. And so it's in the favor of the hospice company that this person will die quickly. And so again, we have to be very, very careful and make sure that somebody is there watching what's going on. These guys, they have learned how to present things so that it sounds good. The same is true, by the way, with people who wanted to do the organ, take out the organs or harvesting them, as they would say. And so some of that is perfectly fine and moral, some of it is not. And that's actually what brain death came from. Brain death is a purely a medical concept that was invented to be able to say it's okay to take this person's organs because they're dead. And they're not dead. But that's what brain death was. That was why they invented that, so that the person would still be alive when they take the organs. Again, some of it is okay, some of it is not. The heart and lungs have to be working, for instance, when they take it. So therefore, they have to actually kill the person in order to, so they'll inject some chilled potassium into the heart in order to stop it while it's beating, and then they can take the heart and lungs because they're fully oxygenated, and well, that's just plain immoral, and so again, that's where we have to be very, very careful, because again, part of the euthanasia movement is along those lines. If there's somebody young enough, we can get their organs, and so if we euthanize them, everything will be in pretty good shape, and we can take all these organs. So just again, be clear in your healthcare directives, and be clear about who's making decisions and what the decisions are to be, so that somebody doesn't violate your dignity.
Yeah, and that's the other thing that I thought of too. One, some of these people who advocate these positions, it seems like they clearly don't believe in miracles then, because if they did, they would go, well, anything's now without the realm of, or out of the realm of possibility. And secondly, we don't know, a person's soul is still in there.
Correct.
So they can be perfectly, they can know what's going on, even if it says it's brain dead, because we don't know what our soul can do, what we can think of. We're not in that position. So what you point out is very valuable, I think, because you just have to be on your guard, like you said.
Right, and what's critical is making the right distinctions. That's what it all comes down to.
Thank you very much for your time. I really appreciate it.
You're most welcome. God bless you.
God bless you too.
Thank you.